Picture this. You're just walking down the street, feeling great, and bam, something flies right into your eye. What is your immediate instinct? If you're like most of us, your very first reaction is sheer panic, followed by this intense, overwhelming urge to furiously rub your eyelid. We have absolutely all been there. Whether it's a tiny grain of sand, a rogue eyelash, or just a speck of dust, that minuscule little object can feel like a jagged boulder scraping against your eyeball. It is incredibly uncomfortable and honestly pretty scary. But how you react in those first few critical seconds can literally mean the difference between a quick, easy fix and permanent damage to your vision. Welcome to This Explainer. Today, we're focusing on exactly what to do when that dreaded moment happens. We're going to break down safe, highly effective first aid management for a foreign body in the eye, and we'll clearly outline the critical protocols for when to seek professional medical care. Knowing these simple, actionable rules will empower you to protect one of your most vital senses. Okay, here's our roadmap for today. 1. The foreign body problem. 2. Step 1. Do not rub. 3. Flushing and inspecting safely. 4. Red flags for medical care. And finally, 5. Emergency eye protection. Let's dive right in. Section 1. The foreign body problem. First, we've got to clearly distinguish between the two main types of hazards we're dealing with. On one side, you have common particles. These are your everyday annoyances, things like dust, a bit of sand, or an eyelash, and they just sit loosely on the surface of your eye. On the flip side, we have penetrating objects. These are things that have accidentally become stuck or embedded directly into the eye itself. This distinction is absolutely critical because the way you manage a loose speck of dust is entirely different from how you have to handle a penetrating injury. Section 2. Step 1. Do not rub. Okay, the most crucial point I can give you is this. Do not rub the eye. I know, it completely goes against every single reflex in your body, but rubbing your eye can actually embed that tiny object so much deeper. Worse yet, it can severely scratch your cornea, which is that clear protective outer layer of your eye. A scratched cornea is incredibly painful and opens the door to serious infections, making a minor situation a whole lot worse. Your best first defense is simply keeping your hands totally away from your eyes. Just don't rub them. But you might be wondering, what on earth do you do about that intense discomfort while you're figuring out how to treat it? Well, here's a highly practical relief tip. Instead of rubbing, safely apply slight pressure with a puffed, cupped hand over the eye. Just form a hollow cup with your palm and gently rest the edges against the bones of your eye socket. Make sure you aren't touching the eyelid itself. This gently relieves that sudden, awful irritation by tricking the nerves just enough to calm your panic, all while keeping the eye totally safe from friction. Section 3. Flushing and inspecting safely. So how do we actually get the minor stuff out? For immediate relief, there are two incredibly effective, safe flushing methods using nothing but clean water. Method 1. Fill a clean bowl with water. Literally submerge your eye into it and blink rapidly. The movement of your eyelid combined with the water does a great job of dislodging the particle. Method 2 is to gently pour water directly across the eye, but pay very close attention to the direction here. You must pour from the inner corner near your nose out toward the outer corner. This specific flow ensures you don't accidentally wash that debris right into your other perfectly fine eye. Now, if those flushing methods don't immediately do the trick, follow these exact steps to inspect the eye. First, gently pull the lower eyelid down and carefully lift the upper eyelid while having the person look around in different directions. This exposes those hidden corners where eyelashes and sand just love to hide. If, and literally only if, you can clearly see the object floating loosely on the white of the eye or resting inside the eyelid, you can gently swab it out using a damp cotton swab or a very clean cotton cloth. Listen to me carefully here. Never, ever use anything sharp, and never try this if the object isn't completely loose. Section 4. Red flags for medical care. We need to shift gears now because this is the strict boundary where at-home first aid completely stops, and you need to seek professional help. If you're inspecting the eye and you notice the object is stuck directly on the colored part of the eye, the iris, or over the dark center, the pupil, stop what you are doing immediately. Furthermore, if you can see that the object has physically penetrated into the eye tissue, all at-home flushing and swabbing must cease right then and there. These are highly delicate areas, and any amateur attempt to remove something stuck here can cause irreversible vision loss. Section 5. Emergency eye protection. The absolute golden rule when you spot any of those red flags we just talked about is amazingly simple and totally non-negotiable. Do not touch it. Don't touch the object, don't touch the eyelid, and do not let the injured person touch their eye. Any pressure or manipulation can push a penetrating object even deeper into the delicate internal structures of the eye, which turns a manageable medical emergency into a catastrophic one. Instead of touching it, you need to immediately execute the emergency shield protocol. You protect the eye by covering it entirely with a clean paper cup, a plastic cup, or really any similar hollow object you can find that won't cause further injury. The goal is to create a physical barrier over the eye that rests entirely on the bony orbital ridge of the face. You have to ensure it applies absolutely zero pressure to the eye itself or the penetrating object. This shield is brilliant because it prevents accidental bumps and totally stops the person's natural reflex to rub the area. Once the eye is safely shielded with that cup or hollow object, your at-home job is completely done. Your only remaining task is to get to the emergency room immediately for professional medical care. Do not delay, definitely do not attempt to drive yourself if you're the one who is injured, and let the medical professionals handle the extraction. They have the specialized tools, the numbing drops, and the microscopes required to safely resolve penetrating eye trauma. To wrap up this explainer, I really want you to walk away with this vital takeaway. Confidently flush out the minor stuff like sand and eyelashes safely with water. But if you ever suspect a severe issue, if something is stuck on the color of the eye, or if you are simply in doubt, shield that eye without applying pressure and seek medical help right away. Taking these correct steps ensures you'll be seeing clearly for years to come. Our human instincts are meant to protect us, but when it comes to your eyes, your very first reflex is actually your biggest threat. It kind of makes you wonder what other natural bodily reflexes might actually be putting you in danger. Thanks for learning with me today.